And I would also say it's a real problem in children as well. And people don't think because it was underplayed that COVID doesn't affect children as much. The emphasis on long COVID affecting children was also neglected, and there haven't really been any public health warnings to parents or schools that your child is at risk and they are in high risk environments because ventilation systems and infection control in schools has not been prioritized.
But if somebody contracts or develops long COVID at school age, presumably they're facing a lifetime sentence of having to deal with the symptoms.
The recovery rates for long COVID are not good. It's about 5 to 7% of people recover, and we do hear of people improving. Some people do recover. I mean, my daughter also has long COVID, and you are also faced with a world that doesn't take COVID seriously. And so we had our situation where every infection our daughter has had complications. So because the world isn't kind of adapted for infection control, we didn't take a Southeast Asian model, where masks were normalised or ventilation is normalised or staying home when you're sick,
Doing the basics, that's right.
Even doing those basics, testing, ventilation, even things like fire UVC, all of these things really, there was a real moment that we could have, as a country and a culture, gone, right, this isn't going to be the only pandemic. Nobody wants to get ill, even with flus or colds or anything like that. We could have really instigated a different viewpoint towards viruses and illness. We have very good public health systems with kind of food and water. We wouldn't expect to get any of these things from those aspects. But air, it's like there is a real stigma to it. And we've really missed an opportunity to normalise opening a window or staying home when you're sick. And obviously you need political workplace protections to do that. But because our culture is so based on presenteeism and, turning up when you're sick and all of those things, people don't realise that. And this is even before COVID, with people like ME, if you go out into the world with an infection, you can disable somebody. And, obviously you need the public health messaging around that. But there's an invisible impact that we don't often really recognise as a society. And I really think that needs to change.